The topic we are going to discuss today is excessive drinking. It feels like drinking and urinating more than someone should. Drinking alcohol or coffee, taking diuretics can make it worse. Although it seems obvious, it's important to remember that drinking more than usual will cause you to urinate more than usual. Adults produce an average of 1.5 liters of urine per day and typically do not need to wake up in the middle of the night to urinate unless they drank coffee, alcohol, or a lot of fluids before bed. If patient is urinating more frequently than usual, but not producing more than the average amount, you may have a urinary tract infection or a condition that obstructs the flow of urine. On your patient visit, you will ask him about anxiety, depression, headaches, breathing difficulties when lying down, pain or difficulty urinating, fever, chills, dribbling or change in the force of urine stream, excessive urination at night, excessive eating, swelling in extremities. You will want to know if he or anyone in his family has had any of these conditions: diabetes, anxiety, depression, nervous system disease, brain surgery or skull fractures, kidney disease, urinary tract infections, prostate disease, cardiovascular disease, liver disease. You will want to know how much he drink and urinate each day, and how often he has to get up in the middle of the night to urinate. You will want to know if he's taking any of these medications like diuretics, insulin, or other medications for diabetes. You will do a physical examination including the following: weight, temperature, blood pressure, pulse, thorough eye exam, listening to chest and heart with a stethoscope, digital, rectal exam, checking extremities for swelling. If a patient comes with conditions like waking up in the middle of night to urinate, which occurs after drinking coffee, alcohol, or a lot of other fluids before going to bed, otherwise healthy, he might be suffering from noxuria. If a patient comes with symptoms like weight loss, family history of diabetes, excessive eating, and nightmare urination, he might have diabetes mellitus, which is an inability to properly process sugar. If a patient comes with symptoms like excessive drinking or urination resulting from a mental disorder, more common in people who have anxiety or depression, most can sleep through the night without urinating. He might be suffering from psychological cause. If a patient comes with typical symptoms like insatiable and constant thirst, urine output often exceeds 5 liters per day, may appear after head trauma, nervous system disease, or brain surgery. He might be suffering from diabetes insipidus, which is a disease involving the pituitary gland. If a patient comes with typical symptoms like nighttime urination, use of diuretics, which is common in people having heart disease or high blood pressure, the patient might be suffering from diuretic therapy, which is use of medications that increase urination. If a patient comes with symptoms like history of kidney problems, nighttime urination, weakness, feeling faint upon standing, he might be suffering from chronic renal disease, which is a kidney problem. If a patient comes with typical symptoms like nighttime urination, more common in older men, difficulty initiating urination, frequent urination, dribbling, decrease in the force of urine stream, he might be suffering from partial urethral obstruction, which is a blockage in the tube that drains urine from the bladder, usually the result of prostate problems. So that is all about today. Keep following sqadia.com for more such videos.